Dear foster carers, this is my first attempt at a video message to you all. I thought now, in these times, it was an appropriate time to reach out to you with some messages and a bit of an update about what we're doing around COVID-19 or coronavirus, as I'm sure we're all coming to terms with quite a different social environment. As I'm sure you're all aware, the government made significant changes to the advice to citizens on Monday, asking where possible for people to work from home to minimise social contact and for some people to be shielded or isolated. And these changes, obviously it is necessary at community foster care that we take steps to respond to those. I've been meeting today with the senior leadership team, Emma, Dan, Sasha and myself, and we've been talking about the implications of this new guidance, and we're keen to get messages out to you as soon as possible about how we plan to operate in light of this information, with our paramount concern being the health and well-being of all of our community. I'm sure that many of you, like me, are deeply concerned about loved ones, about your family, and have worries about coronavirus and the impact it's having on our society. I feel that at times like these it's even more important that we're effective at utilising our community to support us all through these difficult times and through these troubled waters, and that is what we'll be focused on as a senior leadership team, in enabling our community to come together and to support us all and to communicate and to be creative in how we find solutions to overcome these challenging problems. You'll be aware that community foster care has already been reviewing its risks and taking further measures to address COVID-19. This has been happening for some time. We've been investing considerable energies in continuing to review our approaches and talk to one another and talk to foster carers and talk to local authorities and talk to other fostering agencies as well as Ofsted about steps we can take and to learn from one another. You'll appreciate that the situation is fluid. We don't have all the answers and the situation is evolving quickly, and actually by working together and talking together and problem solving and being creative will be absolutely critical in successfully navigating our way through these stormy times. I wanted to draw your attention to a number of areas that we've been investing our energies in to try and respond to this current situation. Our first step will be to maintain an up-to-date log of all children and young people, families and staff, and what their current status is in relation to COVID-19, and this will help us to inform our risk management strategy, where families need to have members shielded from coronavirus, where further steps need to be taken for those families to isolate, where people have got suspected cases of coronavirus or are ill. We will maintain an up-to-date log, and I would ask all foster carers to make sure their supervising social worker is aware of changes as they occur in your house on a daily basis. This will be a backbone to how we manage our risk profile and how we address and make decisions about how we will conduct business. Point 2. Effective immediately, all staff will be home working. However, we recognise that there will be times when there is a need for essential in-person contact, and we will judge this on a risk management basis, taking into account the staff status in relation to COVID-19 and the young person status or the family status, as well as potential impact on the child or the family's circumstances, or the way in which we can be creative in providing a successful intervention in a different way, and I'll talk a little bit more about that in a bit. Point 3, in terms of getting hold of us, nothing changes. Our phone numbers, email addresses and mobile phones all remain in active use, and all of our back office functions are well able to cope with remote working. So if you need to speak to someone, do so in the usual means, and if you can't get hold of your social worker, phone the office. Sarah, Sheila or Heidi will answer the phone and the call will be diverted to the appropriate person. So please take reassurance that in terms of keeping hold of us, nothing's changed, despite there being very few staff in the actual offices on a day-to-day basis. As you all know, we need to be home working, as government advice is requiring people to minimise person-to-person contact to only essential person-to-person contact. We will continue with managers, staff and yourselves to review what is essential person-to-person contact and those situations will need to be looked at on a case-by-case basis. Our workers and managers will work with you to manage risk within your house, and as I've said, we'll review on a case-by-case basis and look at the planning implications for your particular circumstances. This will include social workers looking at their stay safe plans for your family household and looking at the particular details of your house and your particular needs and how we can work together to keep everyone as safe as possible. Moving on to our back office functions, community foster care has comprehensive contingency plans in place, and we're well able to manage our back office functions from remote working. All staff are well placed now to work from home and to access all the appropriate files and systems and communicate. So all of that stuff is well embedded, and lots of people have been using home working for some time. Specifically, we have good arrangements in place. We use a firm called BookCheck to manage our financial processes, and that company employs Richard, who will be someone you know who sorts out foster care pay, and I'm sure that will be an important area for you to have confidence in us with. BookCheck have assured us that should Richard get ill in some way, that they'll be able to provide other staff to support these functions, but also Dan and myself have good understanding of all the finance functions, and so in terms of ongoing processing of foster care payments, etc., we have high confidence that there'll be no interruption in regards to those systems. We have lots of contingencies in place to manage someone getting sick, for example. We recognise it's really, really important that we find effective ways to support you and your families, to support happy home harmony at a time when people are going to be spending more time together at home, to look at ways in which we can promote good emotional health during this really difficult time, a time of high anxiety, and children and young people invariably will pick up on that anxiety. Christina Saltmarsh was joining the team this morning in a meeting that we had, and she was underlining to our social workers the importance of maintaining, for example, some good structure within the day for children and young people, so people understand in these uncertain times what the day will look like, and that will be really important from the off when, as we expect, schools will be asked to close their doors for a time-limited period. Christina Saltmarsh will continue to provide her consultations, certainly on a one-to-one basis, but we will also look for ways in which for her to provide group environments for her to share and to problem solve with you. However, these won't be in person. These will be using online platforms, which we're looking at a range of online platforms because we need to be taking into account what you're comfortable with alongside what's available and what we can utilise. Certainly for the one-to-one consultations, we've got significant confidence in the use of WhatsApp video tool for small groups, so that will be something that we're looking at, and there'll be more information coming to you about that as time goes on. Vicky Blackwell and Christina Saltmarsh, our child and adult psychotherapists, will also be spending time looking at strategies and providing information about good emotional well-being and happy home strategies for you at home, and providing that information using a range of channels. So look out for that information as it comes. A word on training. For now, all in-person training, with a few critical exceptions, will not take place. We feel that given the advice from government, we need to put a pause on training, but we'll keep the situation under review. That doesn't mean that people can't access other means of training. For example, Inspire Training do a range of webinars and online training that people can access, and by all means look at Inspire's training website and talk to your social worker if you're interested in any of those. We will also be looking to make training available through these means and mechanisms. Placement making activity will continue as normal. It's critical that we're able to continue to provide loving homes to children and young people in need, and to work and support our local authority partners in helping them overcome the challenges that they're facing at this time. So we have it'll be really important that we continue to work together with you, look at what the risks are in terms of making new placements, and have conversations about how those can be overcome. But absolutely, placement making will continue. We recognise that in limiting person contact, that it's critical that we communicate more in different ways. I kind of think communication is king here, and that's why I'm trying to be creative in reaching out personally using this video as a different way of reaching out to you all. Strong, effective working together will harness and strengthen our community, and that is absolutely critical in us working together to manage and be creative and problem solve together some of the challenges that we're going to face moving forward. Just a specific note on a few of those points. Staff teams and social workers will be meeting regularly by using virtual meeting platforms such as Microsoft Teams and Skype. Our supervising social workers will be talking to you all as foster carers about ways in which they can get you together as groups on a regular basis. We're going to keep this as simple and straightforward as possible. It may be conference calls, it may be using Facebook, it may be using Skype, but do expect to have regular support group meetings, more support group meetings, because I absolutely think it's critical that we communicate more during this difficult time. We will be asking social workers to structure those regularly so you know when they're going to occur. We'll also be having regular discussions with commissioners, with placing authority workers and with other professionals to problem solve together, to flag issues, look at challenges and work together as to how we resolve those. We'll maintain awareness of Public Health England guidelines and also what the NHS are telling us, as well as the UK government, of course, and we'll update our advice to you as that comes through. We're going to have regular fortnightly discussions with other Fairer Fostering Partnership fostering agencies. That's an organisation of all the not-for-profit and charity fostering agencies. We're going to work together, collaborate during this time to make sure that we're learning from one another about these challenges and problems. I urge you to keep abreast of our social networking channels. We're looking to encourage lots of people to come to, there'll be more information coming about this, but to access a closed Facebook group if you're on Facebook, so that we can use that as a means of sharing information and providing emotional support. We'll be sending information out by email. We'll be sending email information through our social channels. Please keep abreast of those. One word, we've done a detailed piece of work, as you know, which isn't concluded, partly due because I had to go off, as people will be aware, but that interrupted the work around foster carer pay and rewards. And I just wanted to touch base on that. I need to talk with the senior leadership team some more about whether we implement some measures or pause the programme during our focus on problem solving some of the matters that arise in relation to coronavirus. However, we recognise that some of those measures foster carers will be keen perhaps for us to implement, so I will give you more information about that over coming days or early next week as to what we intend to do about that. In summary, we all make up a courageous, tenacious, community-centred organisation. All of us play our part in making this a fantastic organisation. All of us are strong, have significant gifts, significant resources that will play a vital part in how we move forward. Please support us all. We'll all work together, communicate and talk about the challenges that are ahead. Recognise that people won't have the answers straight away. I have every confidence that by working together, by working creatively, by working and communicating and problem solving together, that we'll navigate through to smooth waters, and we'll have developed a range of new working methods which will actually stand us in really good stead going forward. For now, stay safe, stay strong. Best wishes. I hope my first video hasn't been too unsettling and that you found it an effective medium. I'll be interested in your feedback. Thanks.